I think for different practices there are different reasons why they need to change. I think some practices are really struggling to continue to operate. So some practices are in real difficulty, and that's difficulties with workforce in terms of recruiting and retaining the workforce, and difficulties with their financial position, because it's a really difficult place to work in the healthcare sector at the moment. And just the demands we see on practices have gone up so much over the last 10 or 15 years, and the resource hasn't really matched that. I don't think we're going to see a big slug of new funding coming into general practice. There might be some extra money, but it won't be for continuing to do the same thing. It'll be linked into practices changing and starting to work in a way that people think is fit for the future. I think also general practice, it's not just that there's a burning platform that means we need to change. I think also because the needs of our population has changed, to provide the right service for our patients, to meet the needs that they currently have, we need to deliver services in a different way as well. So that means being much more thoughtful and coordinated about how we deal with our more complex, frail patients, patients with more complex needs such as mental health problems. And we also need to do a little bit better in providing rapid access to patients when they need our services, and also at times that work for them, because increasingly our patients are juggling really complicated lives and busy work situations, and employers are increasingly inflexible, so we need to start to provide appointments at times that work for patients. I know that's galling, and we think if you're sick but then take time off and come in, that's just not how the world works, and we need to react to that. I think in order to do that, it's quite difficult to do it when we're small independent units all competing with each other for patients and for resource. I think there's real opportunities in practices working together and starting to create bigger structures to do things better. I think that can really help with the workforce issue. So in terms of making your place of work somewhere where people want to come and work for you and to stay there, that's really critical. I think it's quite hard to do unless you start to create a bit more of an organisational structure. So unless you can provide training and development opportunities for people, career progression opportunities, you're not going to attract and retain the best people. And we want to make general practice the place where people want to come and work. So I think when you talk about non-clinical staff, having an organisation where they can see that they're not just going to be a receptionist forever, they might be able to work up through an organisation if that's what they want, and learn new skills and develop. That's true of admin staff as well, giving them opportunities. I think the bigger structure you create, the more you're likely to get good people coming in and staying with you. And also, the bigger you are, the more capacity you have to do in-house training, to think thoughtfully about how you're developing people, appraising them, giving them personal development plans. The more of a management structure you have, the easier it is to do. A lot of practices are still operating essentially with one practice manager trying to do everything, and I just don't think that's feasible anymore. The demands have gone up so much, it's not possible for one person to do everything, so I think you need scale for that. I think also with the clinical workforce, although most practices have just about got the right clinical workforce, but they're struggling to retain them, and it's also difficult to get new doctors coming through particularly, and practice nurses. Increasingly we're going to have to be flexible about the workforce we use. We're going to have to make use of healthcare assistants, physician associates, even pharmacists working in practices. It's really difficult to do that safely and effectively unless you've got a really good management structure for them to slot into, because more experienced doctors can work independently, but most other healthcare professionals need a fair bit of supervision and support. They need training and development, they need mentoring, and the time required to do that effectively is really hard to eke out when you're 3 or 4 doctors working under a huge amount of pressure. If you're a bit bigger, you can create the space and roles to allow people to do that. You can also increasingly start to work as teams where people aren't working in a room by themselves, but they're actually working more as a multidisciplinary team even within a practice, and that's possible to do because we've been able to do that at the Nelson from the scale we've got. In terms of finances, there's definitely some economies of scale as you start to work a bit bigger. So if you think that every small practice is doing all the same stuff in terms of looking at contracts and reporting on delivery of contracts, HR, payroll, IT, there's a huge amount of inefficiency in doing that multiple times in multiple different ways across practices, and so we see that there'll be huge benefits in doing that at scale as well.